Rajanukul Institute, Thailand's first nursing home for patients with intellectual disabilities, was officially established on June 16, 1960. It was originally named Mental Retardation Hospital, which is a specialized hospital for intellectual disabilities that has integrated services. The institute is now located in Dindang district of Bangkok, of which area is approximately 12.6 acres. On April 22, 1979, His Majesty King Bhumibol Adulyadej had conferred the new name Rajanukul Hospital. The aim of this hospital was to improve the quality of life of people with intellectual disabilities, to have better opportunities and equal rights as every individual in society. On March 5, 1964, His Majesty the King and Her Majesty the Queen had presided over the opening ceremony of Rajanukul School. Since then, it has become the first school of special education in Thailand. On July 8, 1966, His Majesty the King had graciously opened Darun Patana building, which was a preparing station specifically for preschool students. At present, the building serves as a facility for physical therapy services. Later on, Her Royal Highness Princess Mahachakri Sirinthorn, on behalf of His Majesty the King and Her Majesty the Queen, had graciously opened Palanamai Building and Mental Retardation Research Center, which was the first research center under the Ministry of Public Health Supervision, to study the possibilities to decrease the incidences of genetic disorders and relevant diseases. On March 21, 1990, Her Royal Highness Princess Kalayaniwattana Gromalwang Narathiwat Rajanakarin came to open the outpatient department building. She also initiated the establishment of a foundation to support organizations in order to facilitate development in many areas. She also accepted to be the patron of the Foundation for Rajanukul Hospital. We were honored to have General Wanchai Rungtrakul as the foundation president, which brought great appreciation to patients and Rajanukul staff. This is considered as a great opportunity for persons with developmental and intellectual disabilities in Thailand under the royal grace of Chakri dynasty, whose concern about the underprivileged people resulted in the later enforcement of Thailand's public health policy. Since the administrative reform in 1999, Rajanukul Hospital has been upgraded to Rajanukul Institute, which focused mainly on research and development. The vision of Rajanukul Institute is becoming the National Excellent Institute for Intellectual Development. In the past 5 decades, Rajanukul Institute has engaged in the mission under the strategy driven towards excellence in intellectual development. It is considered as the country's highly specialized service center for children with intellectual disabilities and has strengthened network alliances in intellectual development. Furthermore, it has improved the quality of management system to meet international standards. Rajanukul Institute provides holistic services for complicated intellectual disabilities, including diagnosis, treatment, rehabilitation, prevention and promotion by interdisciplinary specialist teams, which are medical services, provides diagnosis, treatments and rehabilitations of developmental and intellectual disabilities, and child and adolescent psychiatric problems by child developmental behavioral pediatricians and child and adolescent psychiatrists. Dental service provides services for oral health prevention and promotion, makes diagnosis and delivers dental treatments for developmentally and intellectually disabled people, educates parents on dental care by emphasizing on parental participation. Early intervention and daily life skills training services provides early intervention program for children from birth to 5 years old who have developmental delay and daily life skills enhancement activities for children ages 6 to 18 years who have intellectual disability at all levels. The programs are composed of everyday life skills, social skills, language skills, cognitive skills and basic household skills by both individual and group training. The program also offers behavioral management for improving adverse behavioral problems. Furthermore, it also contains family counseling to increase the family's capabilities and training parents as well as related personnel. Rehabilitation service, which are speech therapy, provides therapeutic programs which are preparing basic skills before speaking, speech and language training, articulation training, voice training, and oral rehabilitation in order to improve speech and language skills. Occupational therapy provides fine motor training for children with nervous system disorders, difficulties in swallowing, poor hand function, and poor eye-hand coordination. Art therapy provides therapy by using different types of art to children with developmental and intellectual disabilities at the age equal to or over 3 years old. Physiotherapy provides therapy for children with delayed motor development, coordination, postural control and balance, musculoskeletal, nervous system and cardiopulmonary conditions by working alongside their families to enable children to carry out activities in daily life with full potential. Psychology services provide psychological diagnosis and therapy. Social work services provide social assessment, diagnosis and plan for social and vocational rehabilitation, helps families of developmentally and intellectually disabled people by family therapy, and systematically improves social life skills and self-rights protection for intellectual disabilities. Educational rehabilitation services provide special education for people with developmental and intellectual disabilities at the age of 6 to 18 years using Individualized Education Program or IEP, prepare children's basic academic skills using various activities in special classes. Community development and social networks supports agencies in the public health systems network to be able to provide service in mental health, child and adolescent psychiatry, promotes and supports operation and knowledge dissemination of child development in early childhood and school age relating to services and care for people with intellectual and developmental disabilities. Develops a network outside the public health service system responsible for the care of intellectual and developmental disabilities, including promotion in child development and mental health in the community at the basic level. we have 3 prototype community service centers, which are Rajanukul Rehabilitation Center, Bangpoon, provides vocational training to people with intellectual disabilities and autism at the age of 15 to 25 years old. Rajanukul Children Development Center, Klongkum, provides service to developmentally delayed children from 18 months old to 6 years old for early intervention and preparation for school readiness. Rajanukul Children Development Center, Muang Care, provides daily living skills training activities for children with intellectual disabilities from 3 to 12 years as early intervention. In the same area, there is also Tarun Banalai Children's Library, which is the first library operated by Books for Children Foundation that encourages children in early childhood and developmentally and intellectually disabled children to read. Rajanukul Institute is the Model Excellence Center for Intellectual Disabilities. We are not only the educational and training center for university students and public health staff, but also the place where education personnel could gain knowledge, experiences and skills to provide services for developmentally and intellectually disabled persons. Moreover, we are the executive manager who provides both training programs for nursing specialty in child and adolescent mental health and psychiatric nursing, an early intervention training program from birth to 5 years old. Throughout the past half-century, Rajanukul Institute has conducted researches in all ranges of developmental and intellectual disabilities. We have delivered qualified researches in intellectual disability and emotion of Thai children. We have also been awarded at both ministry and national level. This is in line with our policy in striving to be the National Center of Expertise in providing services for children with intellectual and developmental disabilities. Today, Rajanukul Institute is ready to move forward and evolve into the national public health arena, as well as to foster cooperation for child development on a global scale, under the context of a new decade that will see us propel towards success as the only excellent center for intellectual development of Thailand.